By packaging your services, I'm not referring to offering multiple visits or specific treatments in a package form. For example, offering 25 chiropractic visits over a course of time for a discounted fee, or 20 neurofeedback sessions, or 20 IV cocktails, etc. This is not the direction I want you to go, and this is really just packaging the commodity model, and the value is still placed on the treatments and services rather than the end result. Understand that your particular package can certainly include specific treatments, supplements, diagnostic tests, follow-up visits, and education. But this is just the plane ride to get your client to their hoped-for destination. Although the plane ride is necessary, the value is in the destination. Think of it this way. Let's say a 46-year-old female, Sarah, comes into your office with a barrage of symptoms, including fatigue, depression, overweight, chronic inflammation, decreased sex drive. Understand Sarah isn't in your office to simply remove some of her symptoms. She's looking frantically for someone who can help her get her life back. She wants to feel pretty, to have confidence, to have intimacy with her husband, and to play volleyball with her daughter. That's what she's wanting. She wants to become super mom or super wife. This is her hope for destination. She's not interested in specific treatments. She's only interested in leaving where she is and arriving at her hope for destination of supermom, super wife. We'll call this destination Fiji. It's where her value lies in her willingness to invest. Simply try to place value on your treatments and your symptom relief, and she will walk out of your office telling you she will have to think about it. Why? Because she sees your offer as an expense that can't be justified rather than an investment. You tried to sell her the plane ride instead of the destination she's hoping for. Let's take this example further. If I were to send the same prospective client, remember, we've substituted the confusing nomenclature of patient to the correct representative of client. We send Sarah to 10 different practices that had extremely competent doctors, but had slightly different approaches. Sarah would likely receive different recommendations, but as long as each one of these practitioners addressed Sarah's personal responsibilities in her daily lifestyle, along with their specific protocols, their treatment supplements, it's likely that Sarah could reach her destination of Fiji if the lifestyle was included, even though each doctor chose a slightly different course of treatments or plane ride. There are different approaches in helping people reach their health goals. So do your patients really care of what your specific treatments are, or are they just interested in getting to their destination quickly and safely? I hope your ego doesn't get in the way here. But the correct answer is they just want to get to Fiji. They don't care about your specific plane ride to get them there. So why would you place all the value in your services or the plane ride? Heck, the plane ride to Fiji, you might get for $800, while the trip itself is worth $9,000, $10,000. Think about the orthodontic model. Is the value placed in the plane ride, which consists of metal cusp, wires, rubber bands, and a series of visits? Or is it the value in the destination of a beautiful, confident smile? An orthodontist knows this and will therefore never place the value in the actual braces. In the Destiny packaging model, you will certainly come to understand that this really is the answer to addressing your client's true needs while allowing you to conduct your business on your terms. You will find that this model brings your client in as a partner in health who will assume personal responsibility and hold themselves accountable for the daily decisions they make regarding their health. This is completely different than the traditional model that tend to address symptoms with a general disregard to fully educate the client as to why they are unhealthy and how they can play a critical role in reaching those breakthrough results. When I refer to fully educating your clients, I am suggesting you have a complete and structured educational curriculum that is designed with classes, videos, written material. A complete curriculum that is not given away for free but comes with a tuition investment. Believing that visit-to-visit education, along with some handouts, is effective is no more than wishful thinking, guys. It rarely has any long-term impact, and when given away for free, has no value. Don't worry, as an FPC client, you'll be able to implement our complete curriculum. It's already built for your use. It is this educational component that will place you as a category of 1 doctor that we just discussed. By packaging your services, you're willing to be transparent with your clients in regard to what they can expect. both in personal responsibility, time, and financial investment, if they are to reach their goals. You, as a practitioner, must act as the expert and the guide to fully communicate this to your client before asking them to participate in your care and recommendations. Anything less is, in my opinion, is a loss of integrity and personal responsibility to those who trust you. You wouldn't treat your family that way. They have a right to know up front what goals can be reached, help them paint that destination, how exactly this is going to happen, and what the exchange of value will be in terms of financial commitment. It's not your job to prejudge of whether a person is willing to apply themselves or whether they can afford your recommendations. Your job is to lay it out for them to decide. Those of you that have been fully dependent on the insurance model usually don't have a problem recommending particular services, as you are not asking the client to invest in themselves. The minute you ask the client to personally invest their money in these same services, all kinds of justifications enter your mind, such as, well, I just don't think the prospective can afford it. This has nothing to do with the client, but everything to do with how much you value your own services and your personal struggles with money. Unfortunately, most doctors are brainwashed into believing this, and you were likely taught by Big Pharma and the insurance companies that you shouldn't worry about the money. You should just focus on the patient's needs and stick to recommending services and products that can continue to build wealth for these conglomerates rather than actually recommending services that are best for your client. The fact is that most of the services that are best for your clients, including health education, proactive services, are not covered by insurance. The reason here is obvious. Insurance companies can't stay in business if people are taught to be proactive in their health. Assuming you focus on empowering your clients rather than managing their disease, you've likely found that many of your services are not covered, and therefore you will need to receive this compensation directly from your client. If you're concerned about feeling like a salesperson, as if this is a negative thing, I would ask you to consider how you would feel if you were an orthodontist asking for $7,000 for your services. No problem, right? Why? Because it's a beautiful, confident smile is every bit worth $7,000, especially if you've got another 40 years to live. Taking one of your patients to a new destination of health to become super dad, super mom, super husband, super wife. Is this not worth a substantial investment? If you have hesitation receiving money for your expertise, I'm going to suggest you likely don't see the value in yourself and what you offer, which in this case means you should probably not accept the insurance money as well. While in practice, my average case value was approximately $8,000. I had no problems with my fee, nor did the patients or my clients. We signed up an average of 34 new clients each month, every month, bringing in between $250,000 and $300,000 in cash each and every month. We achieved this here in San Antonio, Texas, where the average household income was just $48,000. It might be $50 now, but household income, not per capita, household. These are the same folks paying for $7,000 braces, taking trips to Disneyland, and supporting the growth of Starbucks. So if you're in a community where the household income is $48,000 or better, have a Starbucks and successful orthodontist, great news. You have plenty of folks looking for you and willing to pay you, invest in you for your expertise. And here's more great news. By asking your client to take personal responsibility and invest in themselves, you will find that the compliance greatly improves. Their respect for you as an expert heightens, and their personal respect and value for themselves will improve. They see they see your integrity by being upfront and transparent with them. As a characteristic, they will come to demand in their doctors. I've always found it amusing how easily cosmetic dentists, orthodontists, practitioners in the field of cosmetic services have little problem in building highly profitable cash practice. There is no complaining and whining that insurance doesn't cover these services or that. They go into their niche fully knowing that insurance is out of the game, and they will therefore require their clients to come up with the money. If they value the service enough, the outcome, they will find it. This last statement is the key to understanding how some physicians thrive in cash practice while others struggle. Here it is. If you try to sell your services rather than the destination that they want to go to, you will find your prospective clients unwilling to move forward. Please understand your clients have no interest in your services, but are interested only if you can help them reach their goals. Let me repeat this. Imagine the orthodontist trying to justify his or her fee by explaining all the hardware you will receive that make up the actual braces. They spend absolutely no time in discussing this, but stick to the time frame to reach the goal, personal responsibility, and what the outcome looks like. In this case, a beautiful smile. This is where your client sees the value. At FPC, we will work with you to design your unique packages for whatever niche your expertise is in.